Blood Cancer Awareness Month, and millions of Americans are living with or in remission from some form of blood cancer.
And if you're not one of those millions, it touches everyone's life. Many people know someone who is, working through that right now. Many of these cases are B-cell lymphomas, which often develop in adults over 60, but sometimes it can be diagnosed earlier in life. One such case is Astrid, who was diagnosed with lymphoma at 28 years old. She's joining us this morning along with Dr. Matthew Lunning, hematologist at the University of Nebraska's Medical Center, to discuss her trials through treatment. Good morning, you both. Thank you so much for joining us.
Good morning, Travis and Emma.
Morning. Appreciate
Good morning.
the time.
Thank you.
Yeah, so Dr. Lunning, let's start with you. Can you tell us about blood cancer, what exactly you are studying here, and if there's like a particular type that you're hoping to discuss with us?
Yeah, so I'm a blood cancer doctor specializing in lymphoma, and I've been involved in clinical trials utilizing CAR T-cell, namely Breyanzi, and both Astrid and I are compensated for our time by Bristol Myers Squibb. So large B-cell lymphoma is the most common non-Hodgkin's lymphoma. There's over 60 different kinds of non-Hodgkin's lymphoma, but this is an aggressive lymphoma. Commonly, patients are symptomatic. They may present at the ER or maybe even diagnosed when they're in the hospital. The median age, as you alluded to, is about 66 years of age.
So Astrid, where does your journey with blood cancer begin? Because you were diagnosed at a much younger age than, that 60-year threshold there. So where does your journey begin with this, and how have you been working through it?
That's right. I was diagnosed when I was 29. I was just in my master's program finishing physician assistant school when I started having a lot of itching in my body everywhere. I was having these flu-like symptoms, getting sick pretty often, night sweats, and ultimately I went to the emergency room, and that led to my diagnosis of large B-cell lymphoma. I had to undergo aggressive chemotherapy for about 6 months, and then after my treatment was done, unfortunately, my cancer came back pretty quickly after that. At that point, we were devastated to hear the news, and my doctor gave me two choices. It was either a stem cell transplant or enroll in a clinical trial that had a new therapy called CAR T-cell therapy.
And that brings us to our next question, Dr. Lunning. What is CAR T-cell therapy? What advancements have been made in the treatment of blood cancer? I know it seems pretty common for the cancer community, so talk to us about the evolution here.
Yeah, no, it has been an evolution. And, with diffuse large B-cell lymphoma, commonly patients are treated with curative intent with intensive chemotherapy. Unfortunately, about 40% of those individuals either relapse or have their disease still present at the end of their first therapy. For 30 years, you heard it, high-dose chemotherapy and an autologous transplant was the standard of care. CAR T-cells now, went toe-to-toe against the transplant in a randomized trial in adults. And in that regard, CAR T-cell did achieve complete responses in 75% of the patients, which led to durable responses, and that trial was ultimately positive in favor of CAR T-cell Breyanzi, and that's called the Transform trial. Now, CAR T-cell is not a walk in the park. There are, side effects that can come after the infusion of the CAR T-cells, including cytokine release syndrome, neurotoxicity, and the potential for secondary malignancies. So it's incredibly important, if you have a CAR T-cell, to continue to follow with your healthcare provider.
Well, Astrid, how did that CAR T-cell therapy go in your case?
Yeah, so in my case, the first 30 days were very hard. I was very fatigued. I couldn't even walk up the stairs. My husband had to carry me to our apartment. But then quickly after that, I want to say, after the first month, 2 months, 3 months later, I was regaining my strength. And then 6 months after, I was told I was in remission.
Wow. Well, glad to hear that the remission was there. Congratulations. Wow.
Yeah, so Dr. Lunning,
Thank you.
Where can someone go to learn more about this treatment option?
Yeah, one of the locations is Breyanzi.com. The spelling isn't intuitive in the name, so I'll spell it out for you, BREYANZI.com.
Okay, well, thank you both so much. Thank you, Astrid. Thank you, Dr. Lunning, for sharing this with us. I'm sure it'll be very helpful for a lot of people. Thanks so much.
Appreciate the time. And
Thank you. Appreciate being here.
Thank you. And for more information on Blood Cancer Awareness Month, you can go to bloodcancermonth.org as well.